really happy to have our next guest, next person I get to talk to. Dr. David Messenger is the head of emergency medicine at Queen's University. He's a physician in emergency medicine and critical care at Kingston General Hospital in Kingston, Ontario. He's got a whole raft of academic qualifications, and I'm pretty proud of him because he's also my brother. Dave, thanks for being willing to come on and talk to us today.
My pleasure, Michael.
So how are you doing? First of all, how's your family? You hanging in?
Yeah, we're doing well, trying to find ways of keeping my son entertained at home and keeping up with school while also keeping up with work. And seems like a never-ending slew of Zoom meetings and clinical work. It's been a interesting and challenging time. I think some of the busiest months of my life.
Obviously, the reason that we want to talk is to hear a little bit about what's it's like on the front lines. You're an emergency room doctor and head of the emergency medicine program at Queen's and at Kingston General Hospital. So you are the organizer in charge of being ready for COVID-19. What has that meant for you?
Obviously, our priority has been working to ensure maintained access to good healthcare for the people who need it, while at the same time trying to protect our community, protect scarce resources within the healthcare system, and included among that are our staff, and how do we look after the people on the front line providing care. So those have sort of been my big preoccupations.
World Vision, we recently published a study based on our experience with Ebola and others, that in fact, where we're going to see the biggest impact on vulnerable girls and boys, children that we're particularly working with, it's on the secondary impacts. It's not even so much a health issue as it is all of a sudden the primary healthcare systems are maxed, so vaccinations are getting behind. There's a food security issue, the kinds of infrastructures that are there necessary, and then of course the economic sustainability. All of those things that are so key to increasing the development of a community have all been compromised, and it has this knock-on effect. These what we call aftershocks. We're going to see that in Canada, but we're seeing it perhaps even more acutely in the developing world.
I had a trip to Ethiopia last year, where my department is partnered with a university in Eastern Ethiopia, working on building training systems and training capacity for emergency and critical care physicians where they don't currently exist. And I can't imagine the challenge that those systems will have in providing anywhere near the kind of care that I know the physicians there would want to provide, that the staff there would want to provide, just because of how under-resourced they are relative to my hospital even. An entire country effectively has the same ventilator capacity that my one hospital does.
Absolutely. And even at the community level, where we've got community health workers, 220,000 of them around the world that are working day in and day out. But you know what, things that we take for granted, for so many of us in Canada or in the developed world, a month or two where we don't leave our houses or, try to do social isolation or just try to do basic things like hand washing are actually really hard. If you're in a refugee camp in Cox's Bazar, Bangladesh, or Syrian refugees in Jordan, you're living to 12 people in a tent, different families mixed, lack of access to clean water. Or if you rely on the income from being a day laborer, where if you choose to stay in your house, you're not going to feed your family. Even the preventative public health side of things is even that much more challenging in those international contexts, even alongside what kind of care might be provided in an institution like a hospital or a health center.
Yeah. And what's in some ways very tragic is that those stories aren't going to get fully told, in part because there's just no capacity to actually identify the prevalence of disease in those communities, right? There's no infrastructure for widespread testing. There's no ability to trace and track epidemiology of the illness. Many deaths aren't going to get captured in governmental epidemiologic data and reporting.
Dave, sometimes there are people who are working behind the scenes. We're calling them hidden heroes. Can you think of anybody in your world that you've kind of encountered or connected with that you think of as a hidden hero in this pandemic that's worth kind of raising up and saying thank you, expressing gratitude to?
Within our healthcare system, I think actually the people who get the least recognition and do one of the most important jobs in this kind of context are actually the cleaning staff in our hospital and in our emergency department. These are people who, are cleaning rooms after every patient is in them. They're wiping down all the surfaces. They feel the least informed about the healthcare decisions, but they're such a critical member of the healthcare team. I think they are a group that doesn't get the recognition they need and really deserves a thanks and celebration.
Fantastic. Dave, thanks so much for talking with us and sharing the experience at the front line. Give our greetings and the best to your team there. Keep up the good work. And I say this with all affection. I'm proud of you, little brother. So
thank you very much, Michael. Keep up your good work too.
Thanks, Dave.